I am Chantel Hewlett, and I'm currently working at Texas Women's University as a psychologist for the students who are attending that university. Texas Women's University is located in Denton, Texas, and this university has a diverse student body. There are many different races, cultures, origins, and beliefs. As a psychologist working for the school, my job is to help the students with whatever issues they are facing at the current time. Things that I help students with range from trouble with friends to severe anxiety or depression. The school's main concern among the students attending counseling is the increased rate of anxiety disorder. Generally, in one semester, I see about 10 out of every 50 students suffering from anxiety disorder. This disorder is generally associated with feelings of worry, fear, nervousness, or stress. Anxiety disorder can be caused by something in specific or by life in general. The anxiety comes when an individual believes in extreme consequences that are disproportionate to the past or future events. In some cases, this disorder can cause physical as well as psychological symptoms. Some physical symptoms can include increased heart rate, shaking, headaches, dysapnea, nausea, diarrhea, constipation, dyspepsia, insomnia, or fatigue. This disorder, like many other disorders, has varying severities. That is why one treatment will not work for every individual suffering from this anxiety disorder. However, treatment for anxiety disorder usually consists of counseling, medication, or both, depending on the severity of the disorder. Individuals with mild symptoms will use counseling to help manage their disorder. However, individuals with severe symptoms generally need counseling in addition to medication to manage their disorder. Anxiety disorder can also be associated with many other disorders, including, but not limited to, obsessive-compulsive disorder, separation anxiety, and depression. Currently, I have a patient that I am treating who will be referred to as Patient Zero from here on out, who is a black female in her mid-20s from the lower class and has a history of depression in her family. Patient Zero was diagnosed with anxiety disorder, obsessive-compulsive disorder, and depression. The recommended treatment for Patient Zero is psychotherapy in addition to medications prescribed by her doctor. In Patient Zero's counseling sessions, the one thing that we work on is bradyapnea. This helps her relax and decrease the amount of anxiety that she is feeling on a regular basis. Patient Zero is a sad case where many of her anxiety symptoms could have been prevented. Anxiety disorder can be better treated if parents will help their children learn how to respond to stressful situations. Some ways to do this include encouraging children to express their emotion, create a safe home environment, increase activities where children can succeed, and keep them informed about situations and events that might cause them stress. It is also essential that health educators and health professionals take the time to properly diagnose each mental disorder and discover the treatment plan that works best for the individual. Many health professionals do not spend enough time to discover what their patient is truly suffering from, and its effects. And this affects the success rate of the treatment plan and how well the person is able to manage their symptoms throughout the rest of their life. Education is also another issue that needs to be resolved. More and more adolescents are suffering from mental disorders, and I believe that it is important for us to educate them about these disorders and how to recognize them. It is also important that we make them aware that they are not the only ones suffering from these disorders and where they are able to go and get help. Educating adolescents about all of these things will help reduce the rate and the fatality rate associated with mental disorders. I believe that all of these things will really help decrease the disorder and help the individuals suffering from mental disorders.